This in-service demonstration is for operative scrub technicians. For complete operation, please refer to the instructions for use. The Contour Curved Cutter Stapler is intended for transection, resection, and/or creation of anastomoses. The instrument has application in multiple open or minimally invasive general, gastrointestinal and skeletal muscle, gynecologic, urologic, and thoracic surgical procedures. Please verify compatibility of all instruments and accessories prior to using the instrument. Using sterile technique, remove the instrument from the package. To avoid damage, do not flip the instrument into the sterile field. Remove the staple retainer from the instrument by pushing on the pad labeled Push to Remove. Hold the cartridge when removing the retainer. Check that the cartridge is fully loaded into the instrument after the retainer has been removed. Discard the staple retainer. To reload the stapler, follow these instructions. Remove the used reload from the instrument. Grasp the top of the reload and lift upward, unsnapping the reload from the jaws. Properly discard the used reload. Using sterile technique, remove the reload from the package. To avoid damage, don't flip the reload into the sterile field. Depress the release button to ensure the instrument is in the open position. Assure that the retaining pin has been retracted. Examine the new reload for the presence of a staple retainer. If the retainer is not in place, discard the reload. Don't remove the staple retainer until the reload cartridge is inserted into the device. The staple retainer cannot be removed until the cartridge is correctly loaded into the device. The loaded device cannot be used until the staple retainer is removed. Insert the new reload into the metal housing and snap into position. The tracks on each side of the reload should be used as guides to align the reload within the jaws of the instrument. When the reload is properly aligned, push the reload into the instrument until it is fully seated. Remove the staple retainer. Check that the reload is held firmly within the jaws. If the cartridge is removed from the device, whether the cartridge is spent or not, and if the staple retainer has already been removed from the cartridge cannot be reloaded into the device. After reloading and after removing the staple retainer, observe the surface of the new reload. If drivers protrude out of the reload, replace with another reload. The stapler is now reloaded and ready for use.